Hi, my name is Trey Custer, and the workshop I will be presenting is Uncommon, Working with Amputee Athletes. No matter what health rehab field you go into, you will most likely have a case involving an amputee athlete. So knowing how to work with and knowing the factors both psychological and physical that affect them will help you, the audience, better understand your client and help improve their rehab. The objectives that we will be covering in this presentation will be physical factors of amputee athletes, psychological factors of amputee athletes, and finally, exercises and ways to overcome these factors. So for our first objective, we'll be covering the physical factors of amputation. These include mobility and dexterity, phantom limb pain, infection, muscle contractures, deep vein thrombosis, fatigue, deep tissue injury, ischemic heart disease. I have also included with and without prosthetics, since technically it is not a requirement that you get a prosthetic. So we will begin with the physical factors of amputation without a prosthetic. They include overuse of muscles, strain on muscles, shoulder and back pain, tendinitis, bursitis, arthritis, as well as reduced activity, which can lead to weight gain, increased vascular heart disease, among other things. As for the physical factors of amputation with prosthetics, they include reduces phantom pain, complications of postural alignment, complication of muscle imbalance and strains, and complications with gait or abnormalities. You might be wondering what gait abnormalities are. This is when you deviate from your normal walking pattern. I also found that according to Serious Law, up to 80% of all amputees are affected by phantom limb pain. You might be wondering what bursitis is. It is a painful condition that affects the bursae, which are small fluid-filled sacs that cushion the bone, tendons, and muscles near each joint. This can play a major factor since if these are not there, the muscle and the bones could rub up against each other, causing a very painful feeling. Also, according to the articles, what are some of the long-term physical effects of using or not using a prosthetic? That ischemic heart disease was 2.4 to 4 times greater in a long-time amputee compared to general populace. You also might be wondering what muscle contractures are, and according to Serious Law, they are when there is an imbalance of the muscles in a limb, and the best way to avoid them is stretching exercises. Our next slide and point is the psychological factors of amputation. These include depression, phantom limb, PTSD, anxiety, distress, self-esteem and body image are affected, impacts to their social life, as well as they experience the 5 stages of grief. All of these results are based on age, personality type, among other things. And this is all according to the article Psychological Adaptation to Amputation. Also, according to Serious Law, the fact that a normal body image involves all 4 limbs, having lost one will seriously affect a person's body image. Our final slide and point is exercises and ways to overcome these factors. We will start out with exercises to overcome these factors. They include progressive muscular relaxation, which is a process of tensing then relaxing muscles, centering, which teaches you to redirect your energy to make you feel grounded, diaphragmatic breathing, which encourages maximal effective breathing, ratio breathing, which is a technique that focuses on the ratio of inhales and exhales to help calm the nervous system and control thoughts, as well as mindful meditation, which is a technique that involves being fully present at the moment with judgment. All of these that I just listed are relaxation techniques that can help against anxiety. We will move on then to the ways and ideas to overcome these factors. These are just some of the ways that you can overcome these factors. These are not all of them. They include getting prosthetic limb, introducing your client to a previous successful rehabilitated amputee client, presenting the amputation as a lifesaver versus a last resort, the team approach, and as well as support and self-help amputee groups. You might be wondering what the team approach is. The team approach is, according to Digital Resource Foundation, when you have your client working with multiple people from different professions, with each one having a specific role to answer any specific question related to that person's field of expertise. Also, when you present the amputation as a lifesaver versus a last resort, people will be more open to it, as well as it could help reduce some of these physical and psychological effects. Also, introducing your client to a previous successful rehabilitated amputee client will show them that the process works and that even people that have lost a limb can still have a normal, successful life. So in conclusion, by knowing both physical and psychological factors and how to overcome them, you can successfully plan an exercise program for your client that will be both effective and efficient. And here is my resources that I use for my workshop.